Joint pain in the horse is usually caused by trauma and or chronic arthritis, either or. Acutely, you'll see a horse that will jam up a limb, and whether it be the carpus or the knee, fetlock, stifle, hocks. In the acute phase, it usually has quite a bit of local effusion into the joint, meaning that there's swelling. This is typical after a horse has maybe jammed an ankle up or a hock up or whatever due to whatever activity they've been in, or even when they get turned out. We see it in foals. The foal will be turned out, run around a pasture, and come back in with a big, hot, swollen ankle, that they didn't have the day before, that day earlier, or a hock that's fused and swollen and sore that they're walking off, limping on, or a stifle that shows quite a bit of fusion that they're walking, they're gingerly on, or they're have a gait deficit or a limp on it. Usually it responds quite nicely to topical therapy, anti-inflammatories, cold water, hosing, this sort of thing. When it becomes a chronic problem over 3 or 4 or 5 days and this effusion stays in there, then we need to look at the possibility of fragment and or the early signs of arthritis in that joint. Typically we'll take a radiograph of the knee or the carpus, fetlock, stifle, hock, and see if there is not a fragment, or maybe potentially if you have to go to the trouble, especially in the stifle, of ultrasounding or using another modality of diagnostics to see if some of the soft tissue in that joint has either got a tear of the collateral ligaments or the ACL, or which horses get as well, or there's a tear in the meniscus. You radiographically you can't see it, and the horse because of its size does not lend itself to a MRI. So we'll use an ultrasound to look at that soft tissue to see if there's not a defect in it or a tear. And if that occurs, then obviously you have a more serious problem that may require surgery or long-term rest, or potential retiring if it's an athlete. But most time joint pain is elicited by effusion or fluid increase in that joint by picking up and moving it, manipulating that joint and flexing it, where they'll show discomfort or increased gait deficit after you flex them and trot them off on a flexion test, or basically just by discomfort when you pick up a limb, and by virtue of the amount of effusion they show quite a bit of inability to flex it because of the amount of fluid in it. So therefore it creates a tremendous amount of discomfort upon manipulation of the joint itself.